Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Wynn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello and welcome to this episode of the Healthcare Connections podcast. I am your host, Jeremy Wynn, the Director of Sales here at Healthcare Compliance Pros. Got a really great guest and I think a timely topic and some important topics that we're going to talk about today. I've got Jennylynde Renteria-Packham. She is the founder of Courage Coaching. Welcome to the episode, Jennylynde.
Why, thank you, Jeremy. Thanks for having me today.
Absolutely. You have an amazing background. I don't want to mess it up. I want to give you the chance to kind of talk about, just tell us your story.
Sure.
Your past, your history, what led up to you saying, you know what, I want to go help people and get into coaching.
Yeah, absolutely. Well, I started out as a nursing assistant a longer time ago than I'd like to admit. Became a nurse after that and very quickly rose into leadership in those roles. So I was a director of nursing within a few years of graduating with my nursing degree. Really passionate about long-term care and our elders. Just love the ability to give that respect back, right? Kind of to pay it back for all that they've given us through all of their lifetimes, and got to take care of some really fascinating people through the years. So director of nursing was my passion. As I moved up and outgrew that role in a single facility, became the director of resident services over a whole campus that had everything from the independent living through to those memory care folks. And then transitioned from that into a director of quality role for a company that had a couple campuses. So getting to interact with everybody on every level, getting to be that person who's the face, the smiling face that any regulatory bodies see when they come in, and helping liaison for those sorts of interactions, and really promoting the idea for staff to be open to those interactions when they happen, because they happen in all settings. And then moved into a director of quality for a rehab hospital, and really enjoyed, again, a little bit different setting, a little closer to the acute care side of things, even though long-term care and long-term rehab was more where I'd started out. Just loved the rehab setting and watched them do some amazing things I didn't know in long-term care with frail elders, how quickly you could help a young person with a spinal injury heal. But wow, the science has really come far in all of my time in healthcare. So loved that, and kind of started to back off from wanting to be in charge of everything, and fell into quality assurance for a health system, and really loved that role as well. And helping folks align leadership in different areas to hit those metrics and improve everything, right? When we're all rowing in the same direction, everything gets better. And then that the universe led me from that into coaching, which I realized throughout the years I had done a lot of, just not with that title of coach. So when I had that opportunity to then become my own boss and help others, especially healthcare leaders, really figure out that path forward and how to be the best they can be so that their teams can be the best, and that's how our patients get the best care, that felt like a really natural fit for me.
I love it.
Well, thanks.
I love that you said at one of those positions, you liked being kind of the smiling face for everybody to see. And as we prepare these episodes, a lot of times we get the bios and we get the headshots. And actually, it's funny you mentioned that, because I was like, that was one of my things when she sent over like the headshot. I was like, what a great smile.
Oh, thank you.
So yeah, thank you for that. I mean, amazing experience, lots of depth, and I can see definitely how you've been shaped over the years. So let's talk a little bit about that experience. So all this leadership you've done in healthcare, when you got into coaching, what was it? What were some of the things that shaped your approach now as you take on clients and help guide them?
My role as a frontline leader was always, my approach was a servant leader. So I wanted to do whatever it takes for my team to be successful. That can backfire if you aren't great with boundaries. So I learned a little bit through the years as well about how to have some boundaries and set things up so that I could also succeed, as well as my team succeeding, and therefore our patients getting the best care. And it was really just being willing to learn and not necessarily thinking I'm the smartest person in the room, right?
Yeah.
Because people know things and everybody on our teams knows something that we don't know. So I
Yes.
think the things that shaped me the most was wanting to remain open to see what other ideas other people had and how we could improve that experience, whether it was for a patient or for a staff member or a team member or another team's member in our particular whatever environment or organization was. So for me, it was really about trying to learn from others and implement that in that best possible way. And then it leads to in coaching, helping other people see what they think is the best for themselves, and then how do they want to get there.
Yeah. I love that. What helping others see what's best for themselves. That's one thing that I've seen in my time in leadership is I think sometimes we assume everybody wants to climb this ladder into leadership. And I know in a past role, not here at my current role, but I had somebody who was just an unbelievable sales rep in my organization. And I just naturally wanted to help them become a leader in the organization. And so I would, without asking, I would start giving them some assignments to kind of give them opportunity and experience because I was like, I'm going to help this person. And I learned after a couple months of doing this, I had a great conversation. Luckily, we were good friends. And he's like, I don't really enjoy these tasks. And I'm like, oh, okay. I just assumed you wanted to get into the leadership. And he's like, no, I love my role. And I think this is where I want to be for a long time. And I was like, okay, lesson learned. Don't always assume everybody wants to get into a leadership role. Go help them, become excellent at what it is they want to, strive to achieve and to be. And so I love that. That was a great
Thank you for sharing that story, Jeremy. It is
thought.
for the vulnerability because it's hard to be wrong, right? It's hard to be wrong as a leader, but it's important for us to recognize when we are and then recalibrate, right? We
Yes.
recalibrate every other piece of equipment that we deal with. Why wouldn't we also recalibrate ourselves and our leadership style to support our teams? Because I think we've all been there where we see somebody, we think, oh, they'd be great if they wanted to move up. And I don't remember where I read it, and it was a long time ago, and my age is probably showing. I'm sorry, but there was a whole theory out there about being promoted to your highest level of mediocrity for a while. And it was that exact thing of you can only rise so far. And then if you're not continuing to strive and improve at
Yeah.
whatever level you're at, you're not going to perform well there. And I
Yeah.
think lots of different healthcare settings have those folks, right, who are really, really great at their jobs and they want to stay there. So again, how do we make that experience for them as their leader as engaging and rewarding and empowering as possible so
Yeah.
that they can just thrive in that position? And if that's where they want to stay, great, because we always need that role to have a superb person in it,
Absolutely.
right?
Absolutely. Yeah.
Yeah.
Such a good lesson especially for those young leaders out there that have great people under them. And you're like, they would be amazing at this role. And then you kind of start getting them into that role and they're like, I don't
I
love
like
this.
that.
I'm like, okay, stay amazing at your role. We'll do get somebody else. But yeah, it's
And it
great
hurts
lesson.
us, right, as a leader, because when we mentor up those great folks and they get promoted, then they don't work for us anymore anyway.
That is the truth. Yes. So let's talk about in today's
Mm,
crazy landscape of healthcare. What are some of the biggest challenges you're seeing leaders face today?
wow. There's there's a lot, aren't there? And you
That's a
know,
whole nother episode, right?
right? Probably two or three. And you know that because I've heard your some of your other episodes. You know some of the challenges that are out there. We're always worried about enough supplies, whether the supply is space and buildings, whether the supply is actual DME, whether the supply is computers and software and the correct AI assistant.
Yeah.
I prefer large language model assistant that's going to move us forward because we're still relying on the intelligence of the people, right? But we want a software program that's really going to help them, again, be successful. It all comes back down to how do we help that team be as successful as they can be? Because the other thing we worry about as leaders is enough staff because we don't have it.
Mhm.
Nobody's got it. And
Yeah.
and I coach healthcare leaders and I coach some other industry leaders. And that is a common complaint throughout. There simply isn't enough staff. So then the efficiencies and trying to make things as smooth as possible and as efficient as possible. So worrying about the process and does our policy interfere with or promote good process is something that can be on a lot of leaders' mind, especially healthcare leaders, because we have that large regulatory component,
Yeah.
right? We have a parrot on our shoulder and it's always squawking at us about making sure that we're meeting all those regulatory requirements as well. And that can be really challenging. And I think the other thing for leaders is just that awareness of ourselves, that when we're in a leadership role, people are watching us. And this is one of those instances where what we say is not going to be as powerful as what we do. So
Yeah.
making sure that we're aware that if our words contradict our actions, our words are unlikely to be followed, right? Which again, if we're thinking about how the positive experience of our own self being in the best position and the best health it can be, and we're thriving in our role, that means we can support our teams to thrive in their roles, which means our patients get the best care. That there are implications both ways, right? If we're not taking care of ourselves or aware of that, if we're contradicting ourselves by saying one thing and doing something else, that really sets up the whole experience to be a challenge for everybody else involved and ourselves.
Absolutely. I love that. A lot of times when you think about the challenges in healthcare, like you mentioned one of them, staffing, I hear that everywhere. Um, and so I love that you kind of, towards the tail end of that, you're talking about the individual. One of the biggest challenges is probably making sure you yourself as a leader is okay. Like, how do you protect yourself? So are there any key things, leaders can do to kind of make sure that they themselves, that they're thriving, and so that they can then help their team thrive, or, any tips or tricks that they can do individually?
Yeah, I do have a couple that come up pretty regularly with almost every client I interact with, and one of them is we aren't necessarily, and this is not healthcare specific, but I feel like in healthcare in
Yeah.
particular, we aren't socialized in healthcare to toot our own horn, to take credit for the good things we do, to it feels like we're bragging, right? We don't ever want to brag about ourselves. I call myself a servant leader because I truly believe I am. So it's even hard to take credit for the good things I'm
Yeah.
doing. And I believe that not only does that lead our example setting for teams to be not what we want, because we want our team to take credit when they do something great, and we want to be able to pat them on the back for that, because that's again going to increase their empowerment, their satisfaction, going to hopefully help with longevity in the role. But also sometimes we get in that habit of not remembering that our brain can hear our mouth. So when we speak negative about ourselves, we're kind of putting it out there, right? And we're putting it out there for us to hear. And I found so many leaders who are so hard on themselves. And I
Yeah.
think, gosh, you would never let me talk that way about your spouse or your best friend or your adult child. Like maybe sometimes we even speak negatively about children, but you would never. We don't do that intentionally, I don't think. I think that's just part of that bad habit, right? But we let
Yeah.
that happen to ourselves as well. And we just say these things. Oh, I'm so bad at, oh, I could never, or oh, that never goes right for me. And then turns out it never goes right for us. And we wonder why. What am I doing? Why do I have this terrible luck? Or why is the situation always so awful? And we continue to perpetuate that by not increasing our self awareness to think, I'm not going to talk that way. I'm not going to talk that way about myself. I'm not going to talk that way about my team. We're not going to talk that way about patients. And not all Pollyanna sunshine, right? Like I get it.
Yes.
That's
Yes.
not how that
Yes.
works.
Yeah.
That's not how that works. And
Yeah.
there's probably a little something that is at least we can be cautiously optimistic about, right? We can
Yeah.
be at least neutral about. We don't have to embrace the negative of situations. And it's easy to sometimes, and it's easy to in a group when we're in an industry that has been really struggling. And we just had a 6-year anniversary, right, of when the world changed here in the US for COVID. And that was a big change, and it changed a lot about every single aspect of healthcare and how we have to function within it. So it's easy to feel negative, right? That's the easy
Absolutely.
route. It's important for us to maintain at least cautiously optimistic, I feel, moving forward. And so part of that is listening to our own voices, how we're talking about ourselves and how we're talking about others. The other thing that has come up again with almost all of my clients, and if my clients are listening, they're going to get a chuckle out of this because we talk a lot about a powerful pause. So, that idea of it's okay to take a moment and think about our response.
Yep.
And that doesn't mean we're not listening. We can appear engaged, right? We are nodding our heads, we smile at each other. We, and, and I kind of got a reputation at one of my previous jobs because I would literally put my finger in front of my mouth to make me wait a couple breaths before I would respond. So I'd be like, and people would think, oh, Jennylynne's got something to say. And they were right. I did. But I really wanted to just take that moment and give my brain a chance to sort through. And I wasn't thinking like, oh, I need to remember to say this, right? Or, oh, I shouldn't say anything
Yeah.
negative. It was
Yeah.
just a powerful pause to let my brain do what it's good at, which is figure out the next thing I want to say and how we're going to move this idea or this topic or this concern forward in a way that's going to end up being positive and productive at the end for everybody. And so it's
Love that.
okay to take a second and just pause. I hesitate to do it on a podcast because if you're listening and you just hear me sitting here for a minute, that's going to be weird, but I do it.
I love it. That great advice, and the powerful pause, and then to give yourself permission to be human a little bit, and to, if you're gonna say something negative about yourself out loud, make sure you turn around and also say something positive, right?
Yes.
Because it's amazing how often you can manifest things to happen for good or bad just by how you talk about it. So I love that. Great advice. Okay, as we wrap up, one thing, so if there's one takeaway, and maybe it's what you just said, what's the first thing somebody can do as they're listening to this and they're like, all right, you're right, I need to, here's some things I need to do as a leader. What's the first takeaway? Like one simple thing they can do today that can just help them.
Yes. So the first thing I often tell folks is just listen. Just listen to how you talk about yourself. Just it's kind of like having a food diary, right? We tell people to write down what they eat so we can analyze what they're eating. In the same way, if we just raise our consciousness a little bit and listen to how we talk about ourselves, we will automatically start speaking more positively about ourselves, or at least stop speaking so negatively about ourselves.
Okay, let's end on that. That's awesome.
Thank you.
So for those that are listening, are like, I really could use some help, I'm interested in talking to Jennylynde, best way to get a hold of you?
Yeah, well, I love coaching. And so I actually give the first session away to anyone complimentary because I really think you shouldn't work with a coach that you don't know how they work. So if you go to book.couragecoaching.us, because I am in the US, there is a UK Courage Coaching that I'm not affiliated with. So book.couragecoaching.us, and you can book that complimentary session with me. And we actually have an hour. We sit down and we talk through, we do some real work. And then at the end of it, hopefully you walk away with some goals and some small steps to reach, or you decide you want to work with me more, and that's great too.
Awesome. Jennylynde, this has been fun. Thank you so much for sharing your wisdom today, again, on a topic that I think is important as leaders across healthcare and other industries, again, just face challenging times, and the world's moving fast with so many things, and sometimes it's overwhelming. And I love this today, just the ability to pause, to be okay with yourself, and to keep working on thriving so you can help others thrive. So thank you, Jennylynde.
Thanks for having me, Jeremy.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.